Mike kept working past 65 at a small company he loved, and he assumed his employer health plan had him covered, the same way it always had. He didn't realize that one detail about his employer's size quietly changed the rules the moment he turned 65, and by the time a hospital stay landed on his desk as a bill instead of a claim, the mistake was already locked in. By the time it was fully sorted out, it had cost Mike roughly $43,000, and almost none of it came from the hospital stay itself. Here's exactly what happened, why it's so easy to miss, and how to make sure it doesn't happen to you. Most people assume that as long as they're working and covered by an employer health plan, Medicare can simply wait until they're ready to retire. And for a lot of people at a lot of companies, that's actually true. But there's a rule buried inside how Medicare coordinates with employer coverage that catches people off guard constantly, and it comes down to one number: how many employees your company has. Under Medicare's coordination rules, if your employer has 20 or more employees, the employer plan is primary and Medicare can wait, no penalty, no rush. But if your employer has fewer than 20 employees, the rule flips entirely. Medicare becomes the primary payer the moment you're eligible, and your employer's plan only pays secondary, filling in gaps after Medicare has already paid its share. This isn't a small technicality, it's a completely different set of expectations for how your medical bills are supposed to get paid. Mike worked for a company with about a dozen employees. He turned 65, and like a lot of people in his position, nobody sat him down and explained the small employer rule. His HR contact wasn't a benefits specialist. His employer's plan documents didn't spell it out clearly. So Mike did what seemed reasonable. He kept his job, kept his employer coverage, and figured Medicare enrollment was something to deal with whenever he actually stopped working. For about a year and a half, nothing went wrong because Mike didn't need much care. Then he had a sudden hospitalization, an emergency procedure that, in a normal situation, insurance would have handled the bulk of. But because Mike's employer had fewer than 20 employees, Medicare was supposed to be the primary payer on that claim, and Mike wasn't enrolled in it. His employer's plan, expecting Medicare to have already covered the primary portion, processed the claim as if a large piece of it had already been paid, a piece that, in reality, didn't exist because there was no Medicare coverage in place to pay it. The result was a gap nobody had warned Mike about. Let's put a number on it. The hospitalization and follow-up care came to roughly $28,000 that Mike ended up responsible for out of pocket, once the dust settled on how the claim had been processed. Not because his employer coverage was bad, because it was never designed to be the primary payer for someone in his situation. And Medicare, the coverage that should have been primary, simply wasn't there. That alone would be a rough story. But it wasn't the end of it. Once Mike understood what had happened, he enrolled in Medicare about 3 years after he first became eligible at 65. And this is where the second half of the cost shows up. Because Mike missed his initial enrollment period, the 7-month window built around his 65th birthday, and didn't qualify for a special enrollment period the way people with large employer coverage typically do, Medicare applied a late enrollment penalty to his Part B premium. That penalty adds 10% to the standard Part B premium for every full 12-month period you were eligible but didn't enroll. And unlike almost every other penalty in the tax and benefits world, this one doesn't expire. It's permanent for as long as you have Medicare. Mike was 3 full years late, which works out to a 30% permanent increase on his premium. As of 2026, the standard Part B premium is $202.90 a month. A 30% penalty adds about $61 a month, pushing his premium to roughly $264 a month every month for the rest of his life. Run that out over a retirement that stretches another 20 years, and that permanent penalty alone adds up to somewhere around $15,000 in extra premiums Mike will pay simply because of a 3-year gap he didn't realize he was creating. Combine that with the $28,000 hospitalization gap, and Mike's version of a Medicare mistake comes out to almost exactly $43,000, the overwhelming majority of it from 2 things that had nothing to do with the quality of his health coverage and everything to do with the size of the company he worked for. Here's the part that makes this mistake so easy to fall into. Mike didn't do anything careless. He didn't ignore mail from Medicare. He didn't skip open enrollment on purpose. He simply assumed that I have employer coverage meant I'm covered, without knowing that the answer to that question depends entirely on a headcount number most employees never think to ask about. Now, this doesn't mean everyone working past 65 needs to panic and enroll immediately. If your employer has 20 or more employees, the standard advice is usually that you can safely delay Medicare enrollment without a penalty. and Medicare will simply be secondary to your employer plan when you eventually do enroll. The mistake isn't working past 65. The mistake is not confirming which set of rules actually applies to your specific employer before assuming either way. It's also worth knowing that even when Medicare should be primary, some insurers will still process claims as if you have Part B, even if you don't, quietly leaving you exposed the entire time without any obvious warning sign, right up until a large claim exposes the gap the way it did for Mike. Every situation here depends on your employer's actual size, your specific plan, and rules that can be updated by CMS over time. This isn't a one-size-fits-all answer. And confirming your own situation with your HR department or benefits administrator matters more than any general rule of thumb. So if you're working past 65 or you know someone who is, here's a simple 3-step plan. First, find out directly from HR, not a guess, not an assumption, exactly how many employees your company has for Medicare coordination purposes, since this determines everything else. Second, if your employer has fewer than 20 employees, treat Medicare enrollment at 65 as something to handle immediately, not something to defer until retirement. Third, even if your employer has 20 or more employees and you're safe to delay, mark your calendar for your eventual initial enrollment period or the point you leave that job. Since a special enrollment window typically only lasts 8 months after employment or coverage ends, and missing that window brings the same permanent penalty Mike is now paying for the rest of his life. Mike's $43,000 mistake wasn't about being careless with his health. It was about one number, his employer's headcount, that quietly determined which set of rules applied to him, and nobody along the way made sure he knew to check it. This video is for educational and informational purposes only and is not financial, tax, legal, or insurance advice. The figures shown are based on Medicare rules and premium amounts in effect as of 2026 and general illustrations, not a specific recommendation for your situation. Medicare rules, premiums, and coordination requirements can change and employer plan details vary. Always confirm your specific situation with your employer's HR or benefits department, Medicare directly at medicare.gov, or a licensed Medicare advisor before making enrollment decisions. If you're working past 65 and you've never actually confirmed how your employer's plan coordinates with Medicare, that's worth a phone call this week, not after a bill like Mike's shows up. Subscribe to Mike's Money Adventures for more real retirement stories like this one. And drop a comment with your own Medicare enrollment question. There's a good chance someone else watching has the exact same one. If RMDs and required withdrawal rules are next on your mind, that breakdown is just a click away. 8. Call to action if you're working past 65 and you've never actually confirmed how your employer's plan coordinates with Medicare.